Hello, everyone. Today we're going to be talking about nursing home transitions of care. We will be looking at discharge from hospital to nursing home and nursing home to the community. We will discuss important criteria to be aware of when determining readiness for discharge, identifying and improving access to effective community resources that patients may need for ongoing support. We will also review the important elements of advanced care planning so that the patient's end-of-life wishes are known by and clear to the healthcare team. The objectives for this presentation are: list important criteria to consider when assessing readiness for discharge from hospital to nursing home and from nursing home to community. Identify and improve access to appropriate and effective community resources and describe the essential elements of advanced care planning. Important criteria to consider when assessing a patient's readiness for discharge from a hospital to a nursing home include medical stability, functional abilities, mobility, self-care, cognitive status, understanding of care needs, psychological readiness, and insurance coverage. The healthcare team also needs to ensure the nursing home can adequately meet the patient's specific needs. Key aspects to evaluate are medical status, current medical conditions and stability, active treatment needs, wound care requirements, vital signs within normal range, functional abilities, mobility level, walking, transferring, using assistive devices, self-care skills, bathing, dressing, toileting, eating and swallowing abilities, cognitive status, orientation to time and place, ability to follow instructions, decision-making capacity, presence of dementia or other cognitive impairments, patient understanding, awareness of their medical condition and care needs, ability to follow discharge instructions. Additional key aspects to evaluate include psychological readiness, acceptance of the need for nursing home placement, emotional stability, insurance coverage, verification of nursing home coverage, financial implications of placement, medication management, ability to self-administer medications, understanding of medication purposes and side effects, advanced care plan. Do they have one in place? Understanding the patient's personal values and goals, discussing future medical treatment preferences, identifying a healthcare proxy or decision maker, documenting these choices in a legal document like a living will or healthcare power of attorney, having ongoing conversations with healthcare providers about changing health situations. Here are some other crucial points to consider when discharging a patient to a nursing home. Collaboration with the patient and family. Involve the patient and family in the discharge planning process to address concerns and ensure understanding. Comprehensive assessment. Conduct a thorough evaluation to identify all relevant factors impacting the patient's readiness for discharge. Nursing home evaluation. Verify that the selected nursing home can meet the patient's specific needs and care requirements. Discharge planning team. Coordinate with the healthcare team to ensure a smooth transition to the nursing home. Some of the key criteria to consider when determining a resident's readiness for discharge from a nursing home to the community are medical stability, functional ability in activities of daily living, ADLs, cognitive status, social support system, home environment safety, caregiver availability and capacity, medication management ability, understanding of discharge instructions, and access to necessary community services, all while accounting for the resident's individual needs and preferences. Medical factors to assess: stable medical condition, controlled chronic diseases, manageable symptoms, and no significant recent changes in health status. Medication management, ability to self-administer medications accurately or with appropriate support. Wound care needs, whether any open wounds are appropriately managed and healing. Functional ability to assess: ADLs, activities of daily living. Ability to perform tasks like bathing, dressing, toileting, eating, and transferring independently or with minimal assistance. Mobility, ability to walk safely and navigate the home environment. Cognitive function, level of awareness, orientation, and decision-making ability to manage daily tasks. Social support and environmental factors to assess: caregiver availability, presence of a reliable caregiver at home to provide necessary support. Caregiver capacity, caregiver's ability to manage the patient's needs, including medical tasks and emotional support. Home environment safety, assessment of potential hazards in the home and ability to modify them. Community access to services, availability of transportation, home health care, meal delivery, and other necessary community services. Patient factors to assess: patient understanding, comprehension of discharge instructions, medication regimen, and potential complications, motivation and willingness to transition. Residents' desire to return to community living and actively participate in self-care. Psychological readiness, ability to cope with the transition to a new environment and potential challenges. Important note, when making discharge decisions, it is crucial to prioritize the resident's safety and well-being, considering all relevant factors and ensuring the transition to the community is well supported and manageable. Identifying and improving access for nursing home residents to appropriate community resources involves several actions. Facilities and providers can conduct thorough assessments of individual needs, using a standardized process to assess the resident's needs for a safe transition to home. Individualize a plan based on their needs, ensuring tailored access to services like healthcare, social support, recreational activities, and volunteer opportunities based on each patient's specific needs and interests. Key needs to assess are: needs assessment. Regularly assess each resident's individual needs, including physical, cognitive, social, and emotional aspects. Identify specific community resources that align with identified needs, e.g., adult daycare, senior centers, transportation services, support groups, home-delivered meals. Transportation connections. Establish partnerships with local transportation providers to facilitate access to community events and services for individuals with limited mobility. Explore options like dedicated transportation schedules, volunteer driver programs, or accessible vehicles. Community engagement. Build relationships with local community organizations, service providers, and volunteer groups. Participate in community events and outreach initiatives to promote awareness of nursing home services and available community resources. Resource directory access. Make available to the person an updated directory of local community resources, including contact information, eligibility criteria, and service descriptions. Do a personalized review of key resources that you and the resident anticipate them needing once they go home. Key steps to take include staff training and education. Train all staff members on available community resources, eligibility criteria, and referral procedures. Emphasize the importance of resident-centered communication and actively engaging residents and families in accessing community services. Communication and collaboration. Establish clear communication channels with residents, families, and community partners to facilitate information sharing and coordinated care. Regularly update families on available community opportunities and encourage their involvement in accessing services. Quality monitoring and evaluation. Track the utilization of community resources by residents to identify gaps and areas for improvement. Regularly review and update the resource directory based on feedback from patients, families, and community providers. Here are some examples of community resources for nursing home residents. Healthcare, local clinics, specialists, home health agencies, telehealth services, social support, senior centers, support groups, volunteer visitation programs, recreational activities, adult daycare centers, art classes, music therapy programs, local outings, transportation, public transportation, ride-sharing services, volunteer driver programs, meal services, home-delivered meals, and food banks. By actively connecting nursing home residents with appropriate community resources, facilities can enhance quality of life, promote independence, and foster a sense of connection within the community. During the discharge planning process, it is a good opportunity to invite the resident and family to discuss advanced care planning. Essential elements of advanced care planning include understanding the resident's personal values and goals, discussing future medical treatment preferences, identifying a healthcare proxy or decision maker, documenting these choices in a legal document like a living will or healthcare power of attorney, and having ongoing conversations with healthcare providers about changing health situations. Essentially, it's the process of making informed decisions about future medical care, so there is a known strategy in place when the resident is unable to make decisions themselves due to illness or incapacity. Crucial components of advanced care planning are: create an advance directive. Encourage the resident to create a legal document outlining their end-of-life care preferences, including desired treatments, resuscitation options, and who they want to make decisions for them if they can't communicate. Personal values and beliefs. As a resident, reflecting on what is important in life, including quality of life, comfort, and spiritual beliefs. Medical treatment preferences. Specifying resident wishes regarding life-sustaining treatments like CPR, ventilation, and artificial nutrition in different scenarios. Additional crucial components include healthcare proxy designation. The individual should choose a trusted person to make medical decisions on their behalf if they become unable to communicate. Open communication. Regularly discuss the advanced care plan with residents, family, and their caregivers. Review and updates. Residents need to regularly review and update their advanced care plan as their health situation or personal values change. A recent study by Johns Hopkins shows that even adults aged 80 and older with significant cognitive impairment can meaningfully participate in decisions about their future medical care when properly supported. An important consideration for residents and families when developing and executing an advanced care plan is ensuring comprehension of the implications of different medical treatments and procedures when making decisions. Many residents will also wish to integrate their cultural and religious beliefs into the plan. It's wise for the healthcare team to discuss specific scenarios like terminal illness, severe cognitive decline, and sudden incapacitation with the resident, caregiver, and their family members. Nursing home transitions of care require coordinated efforts to ensure continuity of care. Ensuring smooth communication between the previous care team and the nursing home staff to avoid gaps in care and potential complications. Person-centered approach. Understanding the individual's needs, preferences, and medical history is crucial to tailor the transition plan accordingly. Advanced care planning is an important step in the care plan. Family involvement. Actively engage family members in the transition process to ensure they understand the care plan and can advocate for the resident. Close information gaps. Incomplete medical records or lack of communication between providers can lead to missed important details. Rapid changes in health status. A patient's condition may deteriorate quickly after admission to or from a nursing home, requiring adjustments to the care plan. Monitor psychological impact. Transitioning to a new environment can be stressful for patients and their families. These are our references. Thank you.